Thank you very much. And isn't this a fantastic place to be thinking around innovation? I can think of no better venue. So well done, Tasha and the team, for pulling this one off. So I want to just reflect, I guess, over the last 10 years. What have we been up to? And I'm going to start by just reminding us, when we set sail 10 years ago, I said something, I think, at the opening conference, where I said our job is quite simple. We need to connect, we need to collaborate, we need to challenge, we need to champion, we need to catalyze and accelerate, and we need to create together solutions that build on evidence, create innovation, and create our future. And I also said that we needed to be practice embedded. And we needed to do this as a team. This was going to be a team sport, and we needed to bring all of the players together. So when we set sail with that great ambition, one of the important things that we were very clear about was that we needed the right people around the table as part of a membership team. And I'm delighted to say that we've managed to hold that together over the 10-year period. And whilst, things move and people change, the commitment to working effectively together across our system has always been there, front and center. And we've got a beautifully formed academic health science network that now sits very comfortably with the integrated care systems. And you can see our patch, beautifully formed, with huge possibility and opportunity to share together, to learn together, and to innovate together. And that really is the starting point of where our journey set sail 10 years ago. And I think you all deserve a round of applause because you've all been part of that journey and you've all delivered in spades, both locally, nationally, and in some instances internationally. And I'll say why I think that is the case. So, big round of applause to you all. Well done. Now we need to think about, where do we go next? Where do we go to really ensure that we deal with those inequalities that we know are in our systems? And my view, the only way is if we work together to innovate and create the solutions. It's pointless waiting for central government or anyone else to come and tell us how to do it, because they don't know what we're trying to deal with. So we have to solve this together. Now, we sit as an academic health science network as part of a team of innovation arms around England, 15 academic health science networks, all of different sizes, different flavors, different configurations, but all of them committed to supporting each other. So there is a network of networks. And what we've seen and discovered over the last 10 years is the power of bringing those networks together and sharing. The power of ensuring that if one academic health science network leads on something and it identifies something that could be disseminated, spread across England, then we grab it. And we work effectively together to do that. So we're not reinventing the wheel all the time. And this academic health science network has played a pivotal role in those national programs that have now been taken, having started in this place, and disseminated and spread and scaled across the country. Brilliant work. So where have we been over the last 10 years? Well, 2013 we started. NHS England awarded the first 5-year contract, and many of you in the room will have been party to presenting and championing what we wanted to do. From 2013, we then moved to public-patient stakeholder consultation, recognizing that really our users, our patients, are fantastic contributors of us understanding where we need to innovate. There's no point us innovating if it doesn't connect with patients, carers, families. So we absolutely, from the beginning, built in mechanisms that would enable us to understand both where we thought, from clinicians, life needed to go, but also from users. In 2014, we started to see the launch of Precept, a fantastic piece of work using maternity services across our patch, making sure that we could systemize and roll out the use of magnesium sulfate to protect preterm babies. Pennies. Pennies cost in terms of the drug, millions in terms of the outcomes in preventing cerebral palsy and other conditions for newborns. Very simply, led by services, led by clinicians, and systemised. We then went and held our first industry conference, very importantly, NHS working with research, innovation, academe, and industry, the triangle, the golden triangle that's required. We established the West of England Patient Safety Collaborative, and in 2015 we set up the South of England Mental Health Collaborative and neighbouring academic health science networks. We launched the Safer Care Through News. Remember that? Massive piece of work, all parts of the system working together. The early warning score, both in primary care and in acute settings. Brilliant piece of work. 2016, the journey goes on. We start to get into evaluation and evidence works, online tools. We work with our colleagues. We support the West of England Genome Medicine, a new innovation clearly going to determine bespoke care going forward. We established an emergency department collaborative. 2017, we create evaluation online networks, and in the way into that, we set up our mortality reviews collaborative. Later in 2017, we get the adoption of news announced as a national clinical priority. NHS England, based on our work in the West of England. So fantastic, we're now leading nationally, not just locally. The Office for Life Sciences announces 3-year funding for the academic health science networks to support innovators in industry. Thank goodness the Office for Life Sciences recognised the great work that we do. Emergency Department Safety Checklist is recommended for national rollout and wins the AHSN Patient Safety Award, Best Patient Safety Initiative in A&E, 2018, and so on. You can see we've been incredibly busy, but incredibly focused and successful in the rollout of what we're doing. 2019, we start to see online training launched for care home staff. A big initiative, having recognised that actually if we could just create a few more skills, a bigger confidence level in our care homes, we could see a significant change in the way in which people were supported in those care homes environments. We call for innovations to keep people healthy at home and support young people's mental health and resilience in our Futures Challenge programme. We then see, a little bit later on, Respect, recommending a rollout across Gloucestershire, Bristol and North Somerset. Fantastic piece of work. 2 new programmes are selected for Spread, From Evidence into Practice, Challenge 2019, Peri-Prem. 2020, innovations around Future Challenges programmes, Smart Gym, Gloucestershire. So we're into prevention now, as well as trying to ensure that we connect with a range of people, from the very young through to the elderly. And you can see that the work that we've been doing has been driven by the needs of the service, of the system. We exist to support you all. And that's been critical. There's no point innovators dreaming up things if they're not actually meeting the need. So we've been in that circle trying to understand what do we need, how do we need to employ it, and then how can we make sure that it's adopted and spread across our system. And you've been brilliant, because if something's been piloted in one part of our system and works, everybody has got behind it to then adopt it elsewhere across our system. And that's critical. We need to break the not invented here syndrome, and we've done it. So let's not lose that as we continue our journey. And then finally, obviously in COVID, we pivoted our work to make sure that we were supporting everybody in terms of what was needed. We saw the rollout of the ability to monitor patients at home in COVID. And I have to say I took part in one of the trials. When I was COVID, I got sent the monitor, and I took part in the trial and watched my pulse oximetry levels change as I went through COVID. Very reassuring to a patient as they go through that process, because there's somebody at the end of a phone. Brilliant piece of innovation, very cheap, very effective. So we've been on a fantastic journey, but there's more for us to do. There's more for us to do if we're really serious about reducing the health inequalities that we see in our systems. And that's got to be our focus as we go forward. We recognise the pressures, of course, on every part of our system, our people pressures, our service delivery pressures, cost, all of those things coming together. The only way out of that is to innovate in every part of everything that we do, including thinking about our workforce. So working in partnership with now Health Education England, which is going into NHSEI, is critical if we start to think about the future workforce needs. So the Academic Health Science Network, all of you, have a central role to play in shaping our future. Our challenge is to get on with thinking about that future at the same time as delivering the here and now. And we know that's not easy. We know the squeezes are there, and we know that people are tired. But we've got to get on the front foot. We've got to be able to ensure we create the opportunities, we create the future. And the final slide is just a reminder, in pictures, of your work, our work together, and the impact that has had on millions of people's lives. Some lives saved, some quality of life improved. And that's why we do it. It's because we recognise collaboration, partnership working, and innovation is our future, and you are here to help us design it and deliver it. Thank you very much. I'm now going to turn to Tasha.
Morning, everybody. I'm Natasha Swinscoe. I'm the Chief Executive of the West of England Academic Health Science Network. And I wanted to pick up some of the threads that Steve's started to discuss with us this morning. And I'm thinking before I came here today, what have I learned over the last 10 years about what makes innovation stick and what makes innovation happen in our part of the world? And I think, as Steve says, having an ambitious shared vision across the whole piece and a joined-up approach has enabled us to do some amazing things together, as you've seen over the last 10 years. But what we've done is actually focusing the work of the AHSN, and we're a very small team, on the things that actually you need us to be doing. So being really interconnected and very, very based in the local systems and knowing what your priorities are. And it's all about choosing the right projects. One of my team said to me about 4 years ago, Tasha, it's all about #choose the right project. And he was really right, because if we've got a small team of people, we need to deploy our time and our work and our resources doing the stuff that actually you really need us to do. And I think what Steve has shown through the timeline that he's just gone through with us is that we've managed to do that really successfully over the last 10 years, and we've made some really big, impactful changes. And one of the reasons for that, I think, is that the AHSN is not really owned by any one person. It's owned by all of you. And we work really closely with all of our clinical leads in each of our areas to make sure that we do the right work that you need us to do. Because we're firmly embedded in each of the 3 systems and the whole of the innovation ecosystem. But we're agnostic. We're sort of honest and trusted brokers, if you like. We're trusted by the innovators and also by industry as well, so that we can be that little sort of speedboat that goes in between stuff that you need us to do, working with innovators, working with the academics, and coming up with the right solutions to the problems that you have. So we see the world through these 3 key stages, and you may have heard us talk about the innovation pipeline in the West of England. So we work with innovators and with system colleagues such as yourselves to discover and identify exactly what you need, what problems you've got, what issues you've got, and how we can help solve them with innovation. We then develop that need and develop that request and seek the solutions that are already on the market that we can help you embed in your systems and in your pathways of care. And if there isn't a solution out there, we'll go out to the innovators and we'll seek and we'll work with them to create that solution for you. And then we'll test it and spread it widely. And as Steve has shown, we test it locally first, make sure it works, and then we test it more widely, and then we're able to, across our network of 15 AHSNs, spread that widely across the country. If you want to see some of the innovations that we're currently working with at the moment that are coming through, then obviously there's the innovation zone at the back of the hall, which I really would urge you to go and have a look at a little bit later. And for example, just to give you an idea of the type of income that we can bring into the system, very locally, in the last couple of weeks, we have secured nearly £2.5 million worth of small business research in innovation income for some of our local organisations. We've supported them put bids together and bring that money into their organisations so that they can test and develop innovations that might be ready for you guys a little bit further in the future. And those are companies working in key areas such as inequalities in maternity, stroke, net zero and respiratory. So all of the key things that I suspect are exercising your minds at present. Now, we had invited Tim Ferris, who's the Director of Transformation, to come and join us today. Unfortunately, he's not able to make it, and that isn't down to the snow. But what he has done is given us a video instead. So I'm going to invite us to play that video now, hear from Tim, and then I will come back onto the stage and pick up some threads of what I think Tim is saying to us after we've heard from Tim.
Good morning, everyone. And thank you so much for inviting me to address you at this really important meeting. I'm sorry that I am not there with you. I'm sure I would much rather be there amongst my brethren innovators and supporters of innovation than whatever it is that I am that is keeping me from being there with you today. I guess I'll ask for your forgiveness or maybe your indulgence for a second and just say that I like to start off by reminding myself and maybe setting some context for all of you about the times we live in and the biggest challenges we face. And when I say the times we live in, there are so many places to go with that, but the two most relevant for healthcare and the life sciences is the two major trends that are shaping the entire world. This time period will be known as the period of not one revolution, but two revolutions. The biologic revolution and our understanding of biology, and the data and data science revolution. And we happen to be living at the convergence of those two revolutions. And when you wake up with energy and enthusiasm, and it's a positive thing, this is really exciting to be living at a time when the amount of new knowledge and new opportunities created by our understanding of biology and our unfolding understanding of biology and our rapidly unfolding understanding of the use of digital data and tech around communication, information sciences. It is just extraordinary how many things that were not possible just a few years ago are suddenly within reach. And so as the stewards of this time in this arena, and that arena being the life sciences and the delivery of health services, it is an extraordinary time. I find it a very exciting time. But all of that opportunity brings with it challenges because the number of opportunities in front of us is so great that actually picking becomes a central challenge. But we have something that is going to help us make choices, and that is we are under extraordinary pressure. And I don't need to recount the shape of that pressure, but the pressure is really driven. It's an international pressure. It's not a pressure for NHS England or NHS the devolved nations or the Western world. It is in fact a problem for every country, and that is with the wonderful event of the aging population and the accumulation of chronic illness over a lifetime, which is going to happen no matter what, we are faced with the challenge of delivering health services against a limited workforce and limited financial resources. And so here we have this huge opportunity, set of opportunities, biologic science moving forward and data science moving forward. And then we have some constraints, which are those constraints being the model of care, the demographics, and the pressure that our current model of care and our demographics are placing on the delivery, the unsustainable delivery of services based both from a workforce perspective and a financial perspective. So let's marry those two things up, those two macro trends, and say, well, we have this extraordinary opportunity. Actually, what we really need to do is focus our efforts in ways that will help us out of the conundrum of delivering care to the population in a sustainable way. And so that's the challenge I'm going to put to you. Now, let me say a word about innovation. So the NHS has a huge and proud history of innovation. IVF, whole genome sequencing, CT, MRI. I mean, the list is really long. And if you look at the very recent list, the Galleri trial could completely change the way that we deliver preventive services in this country. I mean, and we will know the answer within 2 years. That is extraordinary. Look at the recent MOUs signed with Moderna and BioNTech around vaccines for infectious diseases, infectious respiratory diseases, and others, and cancer vaccines. I mean, we are planning to start trials of personalized vaccines for cancer in September of this year. And the HSNs are a key part of all of these. So I want to just emphasize, so while there's extraordinary things going on building on the infrastructure and the talent pool within HSNs from these commercial deals from outside, at the same time, there's, if you'll pardon the expression, bottom-up innovation from people inside the NHS and inside academia, meds and eds together, building their own innovations, internal. Sometimes they're operational innovations, sometimes they're data science innovations, and sometimes these are, biotech innovations. And so I guess what I'm saying is, building on that rich history and understanding that there are multiple routes in, we have to make choices. And the choices we make about what we support, we won't always make, it's impossible to always make the right bets. But we do need to focus on the big challenges, and the life sciences vision and the articulation of those are our big challenges. And I might just repeat them. So cancer, early diagnosis, especially cardiovascular disease, mental health, and the treatment of mental health, particularly at the scale that we need using digital products, and neurodegeneration, just to name 4 of the more pressing issues where HSNs have a clear role in evolving our model of care. So let me get to that point, which is evolving our model of care. So we really need to change the way we deliver care. And I will say change the way we deliver care to the elderly with chronic illness in particular, because that's the piece of it that is growing at an unsustainable rate. Everything else is sort of status quo, but the part that's creating the pressure is the demographic changes, and with it the burden of chronic illness. So and so here is my I guess my ask of you. in that in all the excitement, we have to get cracking. How's that for American adopting a non-American expression? And we have to focus on the areas where we have the biggest needs and biggest potential opportunities. That focus can be challenging. It's because any choice involves politics, right? And so this is where I need your help. Collaboration is key for innovation. This is about collaboration between funders and the leaders of health systems, ICSs. Let me say a word about ICSs. This new organizational framework, I believe, is the source of how we're going to get out of our future problem, of these unsustainable problems, because we are going to integrate care across an ICS rather than have individual trusts competing with each other in the local space. That working together, I think if we can get it right, is going to be a huge accelerant to the adoption of innovation. And then I want to just say specifically around the West of England AHSNs, congratulations on getting your group together and spending time together. I always like go to conferences where the people at those conferences have different jobs than my job, because that's when I learn the most about the things that are necessary for us to truly listen to where others are coming from, speak clearly about where we're coming from, and arriving at solutions to problems. It was Bertrand Russell, one of my favorite philosophers, who said that, I'm going to paraphrase here, he basically said, progress is what happens when friends disagree. So your challenge, I think, today is to disagree and be friends. And it's through that friendship, building those friendships, and the articulation of your disagreement, where you come to that progress, that innovation, that adoption of innovation, all of the plans necessary to make a difference. And my closing comment is the clock is ticking. Actually, while the overall problem of the demographics and the workforce issues, all of these are slow problems, we need to treat them as urgent. And we need to treat them as urgent today, because honestly, they are, because it is for our children that we need our children to inherit a more organized, sustainable delivery system that is preventing as much as possible and being as efficient as possible in delivering the acute and subacute services. And in addition, I'd like to thank especially Natasha Swinscoe for her leadership. Leading the HSN is a critical function within the innovation ecosystem within the NHS, and her leadership is very much appreciated. And so thank you, Natasha. So I'll stop there. Again, I wish I was there with you. Have a terrific day together, and I look forward to hearing about the day and about your plans for addressing these issues, big and small, that stand in front of us. Thank you very much.
Okay, so that was our National Director for Transformation for NHS England, Tim Ferris. I'm sure that all of you heard different things from what he said in his address to us there, and there'll be different things that you take away from what he said to us today. For me, as the Chief Exec of the AHSN in the West of England, the things that I picked up from what Tim said was a sense of urgency, that collaboration is key, that we'll only get out of the situation we're in the NHS if we adopt innovation at pace and scale. And that's exactly what the West of England AHSN is all about. So I think he's sort of thrown down a gauntlet or given us a challenge there. But I think if you look at the experience that we've all had working together over the last 10 years, we can rise to that challenge really easily because we've proven already that we can do so. But one of the things I wanted to do now over the next sort of couple of minutes is just share with you some of the things that I'm excited about over the next year or so, where I know that we're going to be working with you guys in this room. Some various different projects that I'm particularly looking forward to seeing take place. So we've got a domiciliary care workforce programme, which we're working on in conjunction with Health Education England and South West AHSN as well. So quite a big programme of work. It's an AI-based logistics solution which is aiming to optimise the workforce in terms of maximising their time and scheduling how they work so that it reduces time to care and more time with the people that they're looking after. And so far, on our Bristol pilot, we've already seen a 40% reduction in travel times. So I'm looking forward to seeing how that pans out over this year. An evaluation report out quite soon on that one. And then, of course, we'll be doing the typical AHSN thing, which is how can we now scale that to other parts of our patch. We've got our Black Maternity Matters programme running as well, working in conjunction with the Health Foundation and BCOCO. And that's looking at reducing inequity in maternity services faced by black mums and their babies, and aiming to increase cultural competency in maternity staff. And we've been working with MBT and UHBW on that as a pilot, and using a collaborative learning approach, we're seeing some great outcomes coming out of that. And the BNSSG pilot is now about to launch itself into BSW and Gloucestershire. So we're already going to be scaling that this year into the 2 other ICS patches. Peri-Prem Cymru, which is Peri-Prem Wales. So Peri-Prem, Steve talked to you about, been really successful in the whole of the southwest regional patch. And we are now going to be exporting that across the river to Wales and working with 12 maternity units there over the next 30 months for them to take up the whole evidence-based bundle as well and to improve optimisation rates for the newborn and reduce incidence of brain injury for babies in Wales. We also have opportunity to co-create lots of other more local programmes as well with our 3 ICSs, and I'm looking forward to those discussions continuing through the board and identifying what other work we can do with our ICSs over the next year. And nationally, because we're part of a national network of AHSNs, the 15 that Steve talked to you about, we are collaborating together on various pieces of work that all 15 of us will do, so we get a really good impact and rollout across the whole of the country. One of those new ones this year is we're working up a proposal to look at a CVD prevention programme. We've done a lot of work in CVD, AF, stroke over the last 10 years. So we've got a really good baseline on which to build that from. So we'll be working that up in the first quarter and coming out to the systems and making some offers to you, I suspect, by June. We've got innovation in Healthcare Inequalities Programme. If you're going to that workshop this afternoon, you'll hear a lot more about the 2 pilots that we're running in BNSSG and BSW for the next year. So if you're going along to that one, you'll hear more information about that. Polypharmacy is a programme that we've been running this year. It's obviously about reducing the number of meds that our patients are on, particularly those that are contraindicated, with obviously the obvious benefits for patients not taking too many meds or not taking any meds because they don't know which ones to take. So we'll be running that for the rest of this year as well. And then there are 2 new things that the AHSN network are going to be focusing on, which is Medicines Pathway and MedTech Pathway. And that's all about how do we remove barriers to the adoption of innovation for medicines and MedTech pieces of device. And working with our NHS England colleagues to identify what those barriers are and try and reduce them so that we can drive adoption of these useful bits of kit and useful medicines into practice a lot more quickly, obviously all evidence-based as well. So those are some of the things that I'm looking forward to. I could stand up here for about 3 hours and talk to you about some of the things I'm looking forward to for next year because that is just a snapshot. So those are just my top highlights.